Aging brings wisdom, experience, and freedom, but it can also bring risks that sneak in quietly, undetected beneath the surface noise. For those over 60, cancer doesn't always announce itself with drama. Sometimes its earliest whispers are easily dismissed or ignored. These silent signs don't come with warning bells. They're subtle, sneaky, and often disguised as everyday annoyances, easily mistaken for aging itself. It's not about fear, it's about awareness. When you understand what's happening inside, you can act before it's too late. The body speaks in clues, but over time, we stop listening. We chalk everything up to just getting older, don't we? A persistent cough, a small bruise, or frequent fatigue, none of it seems urgent, until suddenly, it's something much worse. Cancer is a master of disguise. Especially in older adults, its signals often mimic other age conditions or common minor complaints. Doctors miss them, patients ignore them, but when caught early, many cancers are treatable, even curable. That's why awareness saves lives. Let's take a quiet walk through the silent signs of cancer that often hide in plain sight for people over 60. Let's slow down and pay attention, not to scare ourselves, but to understand what the body is trying gently to say. Unexplained weight loss. You're eating normally. You're not dieting, yet the scale keeps dropping. It feels effortless, almost welcome, but it could be something sinister. Many cancers, including pancreatic, stomach, esophageal, or lung, can trigger weight loss even when your appetite and meals remain unchanged. The body burns more energy to fight the growing cancer. Nutrients are redirected, digestion shifts, pounds melt without permission. This symptom can be overlooked as stress, aging metabolism, or even a positive change, but it's one of the loudest silent signs. If your clothes fit looser and you haven't made lifestyle changes, speak to your doctor. Cancer thrives in unnoticed conditions. Sudden weight loss, especially more than 10 pounds in a short time, warrants a closer look. Don't assume it's harmless change. Persistent fatigue. We expect to slow down as we age. A nap feels good, but chronic exhaustion that rest won't fix, that's different. Fatigue that lingers, drags you down, and interrupts daily life could be a sign that something deeper is draining your system. Cancers of the blood, like leukemia or even colon and stomach cancer, can silently siphon your energy without any outward signs. The body is fighting a hidden battle. Even early-stage cancer can send signals that leave you tired, foggy, and uninspired. People brush this off, blaming bad sleep, getting older, or too much stress. But persistent fatigue deserves investigation, not just acceptance. If getting through a normal day feels harder than it used to, your body might be trying to tell you something important. Changes in bowel or bladder habits. You've noticed you go more often, or less. Maybe you feel urgency, discomfort, or a strange pressure in your lower abdomen. Changes in your bowel movements, such as constipation, diarrhea, narrowing stool, or color differences, can signal colorectal or bladder cancer. It's easy to assume it's diet, dehydration, or a new medication, but consistent change shouldn't be ignored after age 60. Similarly, changes in urination, pain, frequency, incontinence, or blood can indicate issues in the prostate, bladder, or kidneys. Silent cancers often affect the systems we least expect, and these symptoms often don't come with pain until very late stages. Track your patterns. Listen to the bathroom routine. When something shifts for more than a few weeks, it's worth a discussion. Subtle skin changes. Skin cancer isn't always a dramatic black mole. Sometimes it's a tiny itchy spot, a dry patch, a slow-growing bump. If you've had a sore that doesn't heal, a mole that changes, or a patch that bleeds easily, take it seriously. Melanoma, basal cell carcinoma, and squamous cell carcinoma often appear quietly, especially on areas we don't inspect. Older adults often dismiss skin changes as age spots or sun damage, but skin cancer can grow without pain, then spread. Early detection here is incredibly important. Skin checks are quick and non-invasive, but too often skipped until things become dangerous. Look at your skin in bright light, check your back, ask your partner, and if something seems different, get it checked. Difficulty swallowing. You might feel like food takes longer to go down, you start avoiding certain textures, you drink more water with meals. Dysphagia, difficulty swallowing, is often overlooked or blamed on dry mouth or aging, but it can signal esophageal or throat cancer. And it's a sneaky symptom. It starts gradually. You adapt without realizing, cutting food smaller, chewing longer, swallowing with effort. By the time swallowing becomes a problem, cancer may have advanced, but early on this discomfort often goes unnoticed. Pay attention to how food feels. Is it getting stuck? Are you coughing more during meals? Is eating becoming less enjoyable? Silent cancer loves to grow in the background while you adjust unknowingly. Don't normalize what used to feel effortless. Persistent cough or voice changes. A cough that sticks around for weeks, not linked to cold or allergies, might be telling you something more serious is happening inside. Especially in non-smokers, this symptom is often ignored, but lung or throat cancer can begin this way, quietly and with subtle changes. Hoarseness, a raspy tone, or throat clearing that doesn't resolve with rest can all point toward early warning signs. Many seniors blame voice changes on age, but when combined with other subtle issues, it's worth bringing to a doctor's attention. Coughing up blood, even in small traces, must be reported immediately. Don't dismiss it as just a tickle or irritation. When your voice shifts or your throat feels strange for more than 2 weeks, it's time to investigate, not wait. Unexplained pain. Pain without injury is a red flag. It can be dull, persistent, or radiating, but when there's no cause, it's suspicious. Pain in the abdomen, bones, back, or pelvis that lingers should never be chalked up to age without a second opinion. Bone cancers, ovarian cancer, and even pancreatic tumors can cause pain that starts vaguely, then worsens subtly over time. Cancer pain doesn't always feel intense. It's often low-grade, gnawing, or odd. It's easy to dismiss as arthritis or strain. But if rest, stretching, or time doesn't improve it, listen to the message. The body rarely hurts without reason. Chronic discomfort is never something to get used to, especially after 60. Pain is a signal. Let it speak. Distinguishing changes in the mouth. Oral cancers are common among seniors, especially those with a history of tobacco use or alcohol consumption, but anyone can be affected. Watch for white or red patches inside your cheeks, tongue, or gums. Also, any mouth sore that doesn't heal is concerning. Ill-fitting dentures, jaw pain, or difficulty chewing can also be symptoms, not just dental problems or aging bones. A persistent bad taste or bad breath, despite good hygiene, may signal underlying issues beneath the surface. Oral cancer often grows in silence until it's too difficult to treat easily. Early checks can save your smile and your life. Use a mirror. Look carefully. Touch the inside of your mouth. If anything feels wrong for more than 10 days, get help. Lumps and swellings. We associate cancer with lumps, but not all lumps are visible. Some are felt only by accident, or not at all. Breast cancer, for example, can appear in men and women, especially post-menopause. Lumps under the arm or near the collarbone matter. Lymph nodes may swell painlessly in the neck, underarms, or groin. These enlargements could be signs of lymphoma or other blood cancers. The texture matters. Hard, immovable, or irregular lumps are more suspicious than soft or tender ones, but all deserve attention. Swelling without injury is another silent signal. It might seem minor, but cancers often build pressure or mass without early pain. Run your hands across your body regularly. What you feel may help your doctor feel more confident in diagnosing early. Persistent indigestion or nausea. Indigestion happens, sure, but when it becomes a constant companion, accompanied by bloating or nausea, it could indicate stomach or liver problems. These symptoms mimic common issues like GERD, food intolerance, or aging digestion, but when chronic, they may mask gastrointestinal cancers. The key is persistence. If discomfort lingers beyond 2 weeks, especially when paired with appetite loss or vomiting, it deserves examination. The stomach's nerves are subtle. Cancer can grow there quietly, tricking the brain into thinking you're just off or under stress. Listen to how food makes you feel. If meals bring discomfort or you start avoiding food, that's not normal aging, it's warning. Tuning into digestion is essential, especially after 60. The gut often speaks first when something's wrong deep inside. Bleeding that isn't normal. Bleeding that occurs without injury is never normal, especially when it's from places that don't typically bleed in daily life. Postmenopausal bleeding, rectal bleeding, or blood in urine are all symptoms that should raise a red flag immediately. Colon cancer, bladder cancer, uterine cancer all may cause bleeding long before they cause pain or produce more obvious symptoms. People often mistake rectal bleeding for hemorrhoids, but any persistent or unexplained bleeding deserves immediate professional attention. Luntine saliva or phlegm, especially in the morning, should not be ignored. It could signal lung or throat issues. If you're seeing blood in the toilet, tissues, or sink, don't guess the cause. Let a doctor determine what's really happening. Changes in appetite. You once loved food, but lately you feel indifferent. Meals don't appeal, flavors seem dull, and you're eating less without effort. Appetite loss in older adults is common, but when prolonged or accompanied by weight loss, it may indicate hidden disease. Cancers of the digestive tract, liver, pancreas, or even lungs can reduce hunger through subtle hormonal shifts or metabolic changes. Food starts tasting off, or you feel full faster than usual. That's a quiet warning, not just a normal aging process. When meals feel more like a chore than a joy, listen carefully. It could be your body's plea for help. Don't ignore your plate. Appetite is a powerful signal. When it changes significantly, it's time to investigate the deeper reasons. Night sweats and fever. Waking up drenched in sweat, even when the room is cool, isn't just a menopause or aging symptom. It could be cancer. Lymphomas, leukemias, and certain infections tied to cancer can cause sudden night sweats that soak your clothes or sheets. Low-grade fevers that return repeatedly without infection might indicate the immune system reacting to internal inflammation caused by malignancies. The body tries to fight off cancer early on, releasing substances that raise temperature and affect your internal thermostat. When your nights become disrupted by overheating and you can't link it to illness or hormones, consider a deeper cause. Track patterns. Fever and sweating at night are not always benign. They could be your immune system's silent scream for help. Shortness of breath. You're walking to the kitchen and feel winded. Climbing stairs feels harder. You're not out of shape, but something's not right. Shortness of breath, especially when it's new or worsening, may be a sign of lung cancer or fluid buildup from other tumors. Even some blood cancers reduce oxygen carrying capacity, leaving you breathless during light activities or at rest. Often attributed to aging, asthma, or heart issues, breathing difficulty can go unchecked until cancer is already well advanced. If you're finding yourself needing more breaks or gasping without exertion, listen to your lungs and bring it to your doctor's attention. Early detection means everything. You don't have to wait until you can't catch your breath. Silence is not safety. Neurological changes. You feel more confused than usual. Your balance seems off. Sometimes your hands tremble. These changes may not be just aging. Brain tumors, certain cancers that metastasize, or even paraneoplastic syndromes can cause cognitive and motor disruptions before obvious symptoms emerge. Dizziness, unexplained headaches, memory lapses, or blurred vision are often dismissed, but they could represent something pressing and serious inside the brain. Even mild changes, like trouble finding words or suddenly feeling off, deserve attention if they persist or worsen over time. The nervous system is delicate. Cancer doesn't always cause pain. It may first distort signals, reactions, or coordination without warning. Listen to your brain. If something doesn't feel right mentally, it may not just be senior moments. It could be a serious sign. Itchy or yellowing skin. Unrelenting itchiness without rash or allergy is a symptom easily overlooked, but it may signal lymphoma or liver cancers silently progressing. The skin often reveals what the internal organs are trying to say. Jaundice, a yellow tint to the skin or eyes, is significant. When bile ducts are blocked by tumors, bilirubin builds up, leading to yellowing, dark urine, and pale stool. Itchiness from cancer isn't always rashy. It's deep, frustrating, and constant. Liver and gallbladder issues commonly cause this sensation before other signs. Changes in skin tone, especially yellowing, signal that something may be affecting how the body filters waste and toxins. Skin is your outer map. It often reflects what's happening inside. Don't overlook color, texture, or sensations that persist or worsen. Swollen belly or bloating. Bloating that doesn't go away, not linked to eating, menstrual cycles, or digestion, can signal ovarian, liver, or gastrointestinal cancer. A swollen belly may feel tight, heavy, or full, even if you haven't eaten much. You may also feel breathless or uncomfortable. Ovarian cancer, in particular, is known for this quiet sign, often ignored until the abdomen grows visibly larger or clothing fits tighter. Excess abdominal fluid, called ascites, is a red flag. This buildup often occurs quietly and grows gradually. If your midsection feels firmer or rounder over time, especially without weight gain, consider what your body might be telling you. Your abdomen is sensitive to internal change. A persistent bloated feeling isn't just gas, it could be a sign of serious imbalance. You've had 3 urinary tract infections this year, or multiple colds that linger, or oral thrush that returns no matter what. Recurring infections are more than just an annoyance. They may signal weakened immunity caused by cancers of the blood or lymphatic system. Cancer can reduce your white blood cell count or interfere with how your body mounts defenses against everyday germs. If antibiotics stop working or infections return faster than usual, your immune system may be under greater stress than you realize. Don't just keep treating symptoms. Ask why your body keeps getting sick. Something deeper may be disrupting your internal balance. Your immune system is your silent warrior. When it starts losing battles, it's time to investigate who the real enemy is. Your nails may seem unrelated to your health, but they often give quiet clues about changes in oxygen, blood flow, or nutrition. Dark streaks, ridges, clubbing, curved nails, or changes in thickness may indicate lung, liver, or skin cancers subtly shifting your biology. Pale or spoon-shaped nails can suggest anemia, sometimes related to cancers that bleed internally or affect nutrient absorption. Changes in your nails aren't just cosmetic. They may be the earliest sign of something much deeper happening under the surface. If your nails suddenly grow differently, lose color, or change shape, don't ignore it. Your fingers may be sending the first warning. Pay attention to every detail, especially those you rarely look at. Silent signs often show up in the smallest places first. Often, we feel something before we can name it. We look in the mirror and don't recognize the tiredness in our eyes. The voice we hear when we speak seems fainter, more strained. We notice changes, but tell ourselves they're just age catching up. The truth is, your body knows before your mind does. Cancer can whisper through mood, posture, skin tone, or movement. Intuition plays a powerful role. If something feels off, even if you can't explain it, trust that feeling enough to check it out. Denial is comforting, but catching cancer early means seeing clearly and acting, even when things seem too subtle to matter. Listen, observe, feel. Sometimes your body is more honest than your thoughts. Don't wait for a scream when a whisper is enough. You don't need to panic, but you do need to pay attention. One symptom doesn't confirm anything, but patterns always tell a story. If something unusual lasts more than 2 weeks, it's time to take note. Combine subtle signs and the picture becomes clearer. Keep a health journal. Track changes in weight, sleep, energy, digestion, and pain. Patterns over time reveal what a moment cannot. Speak honestly with your doctor. Don't downplay your concerns. You know your body better than anyone else ever could. Ask questions, request screenings, and if a doctor dismisses you, seek another opinion. Early detection begins with your persistence. Don't wait for a diagnosis to respect your instincts. Prevention is power. And awareness is the first step toward protecting your future. When you're over 60, it's easy to believe discomfort is just aging. But what if those aches are signals, not symptoms? Your body's messages aren't always loud. They're subtle, persistent nudges that something isn't right beneath the surface of daily life. That's how cancer hides, by mimicking common conditions. That's why many overlook it, shrug it off, or assume it's nothing. You've lived long enough to know your rhythms. When those rhythms change without explanation, you owe it to yourself to listen. A strange tightness, a loss of appetite, a daily ache. These aren't random, they're patterns, and patterns mean something. If you feel like something's changed, but you can't quite explain it, don't ignore it. That's often how the truth first appears. Family history matters more as we age. Certain cancers run in bloodlines. They don't always appear the same way, though. If your parents, siblings, or children have had cancer, especially at younger ages, it may increase your risk silently over time. Let your doctor know your full family history. Even seemingly unrelated illnesses can paint a bigger picture when put together. Some cancers, like breast or colon cancer, have genetic markers. Others just pass down patterns that raise subtle vulnerability. Being aware of this isn't about worry, it's about precision. It helps tailor your screenings and your level of alertness. Your family's past is your tool, not your fate. Use it wisely to protect yourself from surprises that could be prevented. We often feel guilty seeking medical help for something minor. We worry about wasting time, money, or being told it's nothing. But it's better to be safe than sorry. A 10-minute visit can catch a 6-month problem before it becomes a crisis. Many over 60 were raised to tough it out, but cancer isn't impressed by toughness. It exploits silence and shame. The bravest thing you can do isn't endure, it's to investigate, to be curious, to speak up when your body whispers. Don't let politeness cost you time. You have every right to demand answers when something feels wrong inside you. Early-stage cancer often has no drama. It comes quietly, which means your quiet attention is its most powerful adversary. Preventive screenings are one of the few tools we have to catch cancer before it grows dangerous. Don't skip them. Colonoscopy, mammograms, prostate exams, blood tests, these aren't just routine. They're weapons of defense when cancer lurks quietly behind the scenes. After 60, many guidelines change. Some screenings are recommended more frequently, others continue past previous age limits. Screening isn't only about detection, it's about reassurance. A clean scan lets you move forward with peace, not just prevention. Talk to your doctor about which screenings apply to you. Don't wait to be told. It's your body. Take ownership. Detection is a gift. The earlier you find something, the more likely you are to heal, survive, and keep thriving. A common trap after 60 is blaming every symptom on just getting older. It's a lie that hides danger in plain sight. Not every ache is aging. Not every nap is harmless. Not every lump is fat. Assumptions kill more than curiosity ever will. Age can explain a lot, but not everything. Cancer thrives in the places where people stop asking why. Just because something is common doesn't mean it's harmless. Your bones hurt, but is it arthritis or something deeper? You're forgetful? Normal? Or is it a symptom of something more? Don't settle for probably when clarity could change your outcome. Aging should be observed, not accepted blindly. The goal isn't fear, it's alertness. You've earned the right to expect real answers. You may feel off emotionally before symptoms appear physically. Your mood, your energy, your sense of self might shift without explanation. Depression, anxiety, or apathy may quietly surface in the early stages of several cancers, especially those affecting hormones or neurological functions. It's not all in your head. Your brain is part of your body. When the body is unwell, it reflects upward. If you feel disconnected from yourself, lost in fatigue, or emotionally different, honor that feeling. It's not weakness, it's insight. Mental shifts can precede physical symptoms. They're not always imagined. They may be the first honest reaction your system is showing. Don't ignore mood changes. Whether from biology or reaction, they carry truth. Mental health is part of physical health, especially after 60. Many believe if there's no pain, there's no danger. But many cancers are painless until they've reached a serious stage. Liver cancer, pancreatic cancer, and even colon cancer often grow silently, without ache, sting, or visible struggle, until it's harder to treat. Pain is not the only red flag. Changes in behavior, pattern, energy, or sensation can signal something equally urgent. Don't let the absence of pain fool you. Cancer doesn't always warn you with suffering. It prefers the silence of routine. Your job isn't to wait for pain. Your job is to notice disruption. When normal shifts, listen, even without hurting. Pain is a last resort. Cancer usually whispers first. If you ignore the whisper, the scream may come too late. Everyone knows someone who ignored symptoms and lived, or someone who had no signs and didn't. But your journey is your own. Comparison blinds us. It gives us excuses to dismiss ourselves based on someone else's timeline, someone else's outcome. You don't need dramatic symptoms to take action. You don't need tragedy in your family to be proactive about health. Cancer doesn't play fair. It chooses unpredictably. The only thing you can control is your awareness and your willingness to respond. Stop waiting for a sign as dramatic as someone else's story. Start honoring your own inner alarm when it rings. The most powerful decision is to trust your instinct and investigate, not to wait until someone else says it's time. People often ask, what if I go and it turns out to be nothing? But what if it's something? Wasted worry is better than missed opportunity. Time spent ruling things out is always more valuable than catching things too late. Peace of mind is never wasted. One appointment can eliminate months of guesswork. That's worth your time and your strength. Early intervention doesn't just improve outcomes, it saves lives. It also saves money, stress, and future hardship for your loved ones. The relief you feel after a clean test will be profound, and if something is found, you're in a position of power. Catching something early is not bad news, it's the beginning of good news. It means there's still time to choose your path. Caring for your health isn't selfish, it's sacred. It says you still value your life enough to protect and preserve it. Many over 60 feel invisible, especially in medical settings. But your concerns matter. You're not wasting time by being cautious. It takes courage to listen to your body and ask questions others might ignore. That's strength, not fear. That's wisdom, not weakness. Health is not about luck. It's about attention, about care, about love for the body that carried you this far. You are not a burden. You are not overreacting. You are listening, learning, and stepping forward with grace and strength. Your survival isn't just about doctors. It begins with you, the quiet, consistent observer of your beautiful, aging, and still powerful self. Just because you've crossed 60 doesn't mean your time is over. In fact, it means your life is more precious. You've seen more, done more, felt more. That's exactly why your health matters, because what you still have is worth defending. The world still needs your voice, your love, your stories, your wisdom, and your body still needs your protection too. Don't let age convince you to neglect yourself. Don't fall for the myth that prevention is for the young only. Many cancers are survivable when caught early. You are not too old to be treated, healed, and restored to strength. Your life is still valuable, your time is still yours, and your vigilance is a form of love for yourself. You don't need fancy equipment, just a notebook, your attention, and the willingness to check in with yourself every few days. Track your weight weekly. Note appetite changes, unusual pains, odd rashes, or fatigue that feels different than your usual tiredness. Use a mirror. Examine your skin, your mouth, and areas you can't normally see. Ask a loved one for help. Monitor your bathroom habits. Bowel patterns, urine frequency, and color changes are all quiet indicators when cancer begins to develop. Check your energy. Does walking feel harder? Are naps growing longer? These changes often arrive before any test picks them up. Use your journal to compare weeks. Over time, trends become visible and your awareness sharpens like a muscle, ready to protect. Many seniors suffer silently, not because they don't feel unwell, but because they don't want to bother others with concern. That silence can be deadly. Opening up creates a chain reaction. One voice inspires another, and vigilance becomes contagious within families. Talk to your spouse, your children, your doctor. Talk to friends. The more normalized health talk becomes, the safer everyone is. Ask your doctor, what should I be watching for? Bring a list. No concern is too small when you value your future. Encourage screenings in your circle. Your openness could save a life, not just yours, but someone else's who needed your voice. There is no shame in self-care. There is no embarrassment in caution. You're setting the tone for healthy aging through conversation. Sometimes, even when you speak, doctors don't hear you. They may rush, dismiss, or underestimate your concerns due to your age. If you feel brushed off, don't give up. Seek a second opinion. Find someone who will truly listen to your body's story. You are not too old to be taken seriously. You are not imagining things. You know what normal feels like. Trust that. A good doctor partners with you. They ask, they explore, and they understand aging isn't an excuse. It's a variable to examine. You deserve dignity, attention, and clear answers. If one doctor won't give you that, another will. Don't stay silent when dismissed. Advocacy is a skill you can build. Your life is worth defending, even in the face of indifference or disbelief. We are taught to minimize our discomfort, especially older generations who believe strength means silence. But silence is not strength here. Reacting early is not overreacting. It's responding with wisdom. It's seeing a storm on the horizon and preparing while there's still time. Overreaction is rarely dangerous, but underreaction, that's what lets cancer spread silently, unnoticed, until it's too hard to manage. You are not hysterical. You are not dramatic. You are a person who understands the value of catching things before they grow. Don't apologize for caring about yourself. Don't whisper when your body is shouting. Let awareness be your new form of strength. Speak clearly. Move quickly. Trust that every step toward clarity is a step toward freedom. It's easy to feel isolated when health concerns arise, but millions of people over 60 are walking the same quiet path. They too feel aches they can't explain. They question changes. They wonder if it's age or something more hidden, more serious. You're not the only one confused, concerned, or scared, but you can be one of the few who chooses action. Reach out to groups, forums, or communities for support. Shared stories remind us we're not wandering in the dark alone. When you speak, others listen. When you ask for help, others find courage to do the same. In shared knowledge, we grow stronger. In shared concern, we grow wiser. In shared care, we become a community of survivors. Even if something is found, even if a test comes back with unwanted news, there is still hope. There are still choices. Cancer caught early is often treatable, and even later stages don't always mean defeat. Progress is on your side. Modern medicine is evolving fast. Treatments are more effective, recovery is more possible, and options are broader than ever before. What matters most is time, and the earlier you begin the journey, the more control you have along the way. Don't let fear delay action. Hope isn't naive, it's practical. It gives you energy to move, fight, and plan with strength. Even if something is wrong, discovering it now means you're still in control. That's power. That's possibility. That's life continuing forward. What if you began to see every symptom as a whisper of wisdom? What if attention became your form of self-love? You don't need to live in fear. You need to live in awareness. That shift changes everything. With attention comes clarity. With clarity comes early action. With early action comes better outcomes, easier treatments, and brighter futures. You can walk your years with grace, not fear. With curiosity, not denial. With strength, not silence. You are not waiting for something to go wrong. You are living in partnership with your body, present, tuned in, responsive. This is freedom. Not the absence of threat, but the presence of power to meet it head on before it grows. You might feel like you missed something in the past, like symptoms passed unnoticed or screenings were skipped. But today you can begin. It's never too late to become aware, to watch, to listen, to act when something doesn't feel quite right inside. The best time to pay attention was yesterday. The next best time is today. And today you are listening. That matters. One decision, one checkup, one honest conversation can change everything. Don't wait for the right time. Health doesn't follow our calendars. Today is enough. Today is powerful. Today can become the moment where you took charge of your future again. Every day, you choose awareness, you choose life, and there's so much more living left for you to do. This journey doesn't end with this message. It begins. Your attention, your awareness, your wisdom, these are the tools that protect you. You've spent decades caring for others. Now it's your turn. You are worth the same concern, the same love, the same care. Check in with yourself regularly. Stay curious. Don't downplay, don't delay, don't dismiss. Your body is speaking. Keep listening. You have more power than you think. And now you have the knowledge to guide it. Use that knowledge gently, but persistently. The signs may be silent, but you are not. You are alive. You are aging with power. You are still in control. And the more you listen, the more you live. Not just longer, but fuller, clearer, stronger. Stay present, stay safe, stay here.